Joining me now to speak on the ongoing strike by resident doctors, which has crippled healthcare services across the 6 area councils of the FCT, is Dr. Oshundara Zenith, National President, Nigerian Association of Resident Doctors. Thank you so much for joining us on Newsnight. Well, just like Olije Wapera said in that report, a long list of strikes and warning strikes this year alone in the health sector. In January of this year, resident doctors also, carried out a 3-day warning strike. I wonder how much impact really have these warnings had in terms of getting the needed response from the government. Now, here we are again, another 7-day strike. What exactly is the objective of this strike?
All right. Thank you for having me on your studio. The objective of the strike is to have a tool, a negotiation tool, so that government can sit on a round table with you and have a bargaining agreement with you. But unfortunately, most of the time, what we see is that government tries to run away from coming to table to address issues squarely. So what we see is that when they do not come to table to address issues which are germane, which they also agree to have an issue, you now discover that what you have as health workers or as union and association is to down tool or to have an industrial disharmony. In the first place, it's not supposed to happen if we have a responsive and proactive government. But what we have in Nigeria is that most of the time, our governments, they are more reactive than being proactive.
It's the FCT resident doctors that have gone on this 7-day warning strike.
Yes.
So what it means that there are chances that this could spread across the country. In the case of the FCT, on the issue of manpower, for example, I do recall that this year, the FCT minister actually approved the employment of 34 resident doctors. Have they been engaged, these 34 approved resident doctors? What exactly is the situation with that? Because one of your complaints is that there's huge shortage of manpower.
Yes. What is affecting the FCT is what is playing out nationally. You have shortage of manpower everywhere. If you go to most of our hospitals, the number of doctors you find there, they are, very low. The numbers are not commensurate with the load of patients that we see. So the Nigerian Association of Resident Doctors, for which I'm the president, we have also given a 10-day ultimatum, which is going to expire lapse by tomorrow. By this time tomorrow, we'll have our meeting, and it is almost likely that the strike action is going to begin by 12 midnight on Thursday, 12 a.m.
Across
the country, yes. The FCT is just a branch, is a chapter under our own association. So they have their own peculiarities for which they've gone on strike, so that the Minister of FCT can address those issues. So for us nationally, we have our own peculiarities, we have our own issues, which we expect the federal government, either through any of its agency, Ministry of Health, Ministry of Finance, to address squarely. So
how are those issues different? I mean, the FCT issue and at the national level, how are they different? Because on the FCT side, there's manpower shortages, non-functional equipment, poor working conditions, unpaid staff allowances, delayed promotions, and.
It's the same thing over everywhere. It's the same thing. What we have at the national front, we also have unpaid wages as far back as 2023. We have areas of 2023 salaries that has not been paid 5 months. It was initially 7 months, and we've told them that until this 5 months arrears is being paid, it is the industrial harmony cannot be guaranteed. We have a 7-month arrears of accoutrement allowance. We have 2025 MROTF, that's Medical Residency Training Fund, for over 2,000 residents across the country, which has not been paid. Centers like UCH, centers like UPTH, UCT. These are big centers,
Yes.
big facilities, big hospitals in the country. They've not been paid. And the money is actually for exams, to write updates, to update courses, and what will prepare you to, qualify you to become a consultant. So this exam have started, unfortunately, and government has not responded by paying. Now, if this money is not paid, what happens is that the resident doctor is going to lose a year.
Right.
So once he loses a year, of course, you have to go and prepare again, look for money wherever you can find it. But the unfortunate aspect is that the government that has delayed the progress, academic progress of these resident doctors, nobody calls them to question. There is no consequences for their action and for whatsoever they are doing. And we cannot take it anymore. We've been on this issue. We've been negotiating. We've used several, means of reaching out to them.
So both at the FCT level and national level, no response whatsoever from government, or what exactly is government telling you as to why they have not met you based on these demands? Yes,
there is no official communication from from government as of now. What we've been doing on our own part is just to, maybe if you have a connection with this, you see them. If you have personal interaction with several people within the corridor of power, that's what we've been doing.
So you're using back channels?
Yeah, so it's more or less like a back channel. So there is no official communication. They've not even called us to table since we issued this ultimatum,
which of course started yesterday. You've not responded to my question on the FCT minister's approval of 34 resident doctors. I think that was April this year.
Yes, of course. You heard when
with that approval, has the engagement of these 34 resident doctors been?
Some of them have been employed, right. But what happens is that once you have an employment, another set of doctors are going out of the system. So it is the level of employment or the rate of employment is not commensurate with the rate at which people are living out of the system. And you mentioned 34 to take care of the whole of Abuja. It's just too small. 34 doctors.
About 3 million
yes,
population, if I'm correct.
Yeah, 34 doctors.
Do we have an idea of the number of doctors we're talking about here in Abuja? About 4,000?
No.
What are the figures?
They are not up to 4,000.
Okay.
If you because doctors are not just limited to FCTA alone. We have doctors in NHA, that's the National Hospital. Then we have in UATH, that's Gwagalada University of Abuja Teaching Hospital. Then in FFC Jabi. So if you take a census of the number of doctors in FCT, just maybe something around 1.5 or thereabout. But the figures, of course, I can produce it for you after the show.
So after the 7-day ultimatum, what next? What would be the resident doctor's next move?
Well,
if there's no response or positive response from the government.
If there is no positive response, my members will sit down, they will reassess, whatsoever is coming from government, and they will dictate the next line of action, whether it's going to be a total shutdown, total indefinite strike, and that might affect emergency services. And there are several. Which
brings me to that question. I mean, that's my next question, as to, have you as resident doctors sat down to review the impact of this strike, maybe previous ones, and this one that's already into the second day?
No. We have not started as at the national front.
Yeah, I'm talking about the
FCT. Yes, for FCT, I think most time when we have strikes like this, it is even for the good of the patients, because anything we are doing, it is not because we just want to do it for our own selfish gain. You heard when the president of FCT was mentioning that the doctors are not adequately replaced. One doctor, you have to do the work of 4 or 5 doctors. So what it means is that the quality of health service you are even getting as a patient in an healthcare facility is suboptimal. I can't work where 2 or 3 more people are supposed to work, and you expect me to be efficient. So the quality of health work of service delivery is even diminishing, and most people, members of the public, are not looking in this direction. Because I just have to scribble something down. You come, I have a headache. You hardly even have time to, because another patient is waiting in line so that they want to see a doctor, and you want to answer everybody. In the process, you just tell them, okay, what do you have? Sometimes you just use your head to figure out, okay, add one or two together. No investigation is done. Just tell them, please see the next person, do this, do that. So you just give out.
So it's a bad time to fall sick as a Nigerian.
Exactly.
In fact, at no time should a Nigerian fall sick, because with what we're hearing, the situation is truly dire. So what exactly would it take to boost, workers' morale and restore efficiency in the service delivery sector, in the health sector? What would it take? Because we heard, the doctor there say, look, all our demands are low-hanging fruits. And that's,
yes. So
where do we start to unpack it from? So
at the national front, and FCT together with the states across the country, the 36 states and FCT, what we expect government of the day to do is to improve on, one, the incentives, so that if these incentives, if they are attractive enough, it will retain doctors, it will boost their morale to work. The incentives must be competitive. Because if you have a competitive incentive, you will consider what you have in Nigeria and what is being given abroad or any other place.
Are you asking specifically for what is commensurate with what you get abroad?
No, really, but at least something very close. Yes, something very close. We know Nigeria is developing, but we can do better than what we have in the country presently. Then another thing is that government and the Senate of this country must begin to look at the excessive workload that that the doctors are saddled with. Doctors will go, the working hours that will start from 8 to 4. Once you are done at 4, if you are on call, you continue that work, and you can continue like that for a month, non-stop. So there is no policy that safeguards the working hours of doctors. You just go into stress like that, physical stress, emotional stress, mental breakdown. And sometimes you have doctors who are humans, and they can become cynical. So you have negative attitude from doctor, and it's not good for our patients.
And Nigerians are already experiencing that from the health officials. But we do appreciate what you do under so much pressure. Thank you so much for joining us on Newsnight. Hopefully, the appropriate authorities will respond positively to your demands. Dr. Oshundara Zenith, President, Nigerian Association of Resident Doctors, joining us tonight on Newsnight.